Hello, everyone. Welcome to this month's edition of our ProHealth Care Career Pathways virtual presentation. As many of you may know, each month we highlight a different career pathway, and this month we are highlighting the pathway of a registered dietitian. So joining us today is Kelly Grandlich. And she is a registered dietitian at ProHealth Care. I am going to turn it over to Kelly now to share a little bit more about her role and the work that she does and her pathway in healthcare.
Thank you so much. So that was a little introduction. My name is Kelly Grandlich. I am a registered dietitian nutritionist. I have been in this role with ProHealth Care since July 2023, which is about 7 months. And today, what we're going to be looking into is we're going to dive into what it takes to become a dietitian, and then an even deeper look into like what's a day look like as a dietitian. And then we'll end with skills and benefits working at ProHealth. And then first off, I'm just going to start you with my personal journey. I attended the University of Alabama, Tuscaloosa online. They have a dietetic program there. I have a bachelor's degree in communications, and then I decided to go back to school in my 30s to become a registered dietitian. That is a passion of mine. So the best way for me and my family was to do it online and achieve it through the standards that are placed for becoming a dietitian. And then after education, I decided to not go with a program that had the internship integrated into the education. I decided to go with a program where I had to apply once my education was completed. So I placed my application through the DICA's platform. And it's like a matching program. So you have to do your own research and decide what internship is best for you. And I was fortunately accepted into my first choice with Priority Nutrition Care. It was a fast track program to complete my 1,000 hours within 6 months. And I did that. And then after you complete the education and the internship, you then have to take an exam. It's a very hard exam. It's 125 questions, and it can go up to 150 questions. They really want to give you the opportunity to make up points that you potentially missed on previous questions. So there's a little bit of flexibility there with those extra 25 questions. And then I like to cover why I chose to become a dietitian. And number one reason is I like to serve others. And in my mind, what better way to help somebody than with preventative health measures through nutrition? And then also, I'm very passionate about myth debunking when it comes to nutrition because, we have the internet at our fingertips. We can Google anything we want. So for me to be able to have the knowledge to provide that correct information about nutrition to the public. So in order to become a dietitian, you are in school for quite some time. And starting in 2024, actually a master's degree is required. So the first thing you need to do is have the education. You need to obtain a bachelor's degree and a master's degree now. The bachelor's degree and master's degree can either be in they have to be ASCEND accredited. And ASCEND stands for Accreditation Council for Education in Nutrition and Dietetics. And it is an agency that ensures education programs prepare students to begin careers as RDs. So the curriculums with the ASCEND accredited schools are all going to be similar. So right now you can go to school, get your bachelor's degree at an ASCEND accredited college, but you need a master's degree in order to move on to the next step. Your master's degree does not have to be in dietetics or human nutrition, but it does need to be, in something that you're passionate about. And it does need to be completed before you move to the next step. And as I mentioned before, after you complete your education, you also need an internship intertwined with that. So there's coordinated programs, and what that means is that you are receiving education and you're also completing your 1,000 hours that are required to complete your internship. or you apply through the DCAS platform, and that is where you are matched to the internship that best suits you and your passions and your lifestyle. And then the other way is an individualized supervised practice pathway. And this is a pathway that someone would take if they did not get matched during the first or second rounds of their application and matching rounds with DCAS. So after you've completed the education, the internship, you then go on to take the exam. And as I was saying before, that's 125 questions up to 150. And once you pass that, you then need to go through submitting documents from your education as well as your internship to the state that you are going to be practicing in to obtain your state license. And then in order to maintain your licensure and registration, there are fees that you need to pay. I know for Wisconsin, it's every 2 years, and then you have fees to the CDR. But you also, as a dietitian, need to complete 75 CPEUs within 5 years to maintain your licensure and keep up with the latest research in nutrition as a dietitian. So a day in the life as an inpatient dietitian, the main responsibilities is taking care of your patient from a nutrition focus. And the nutrition focus and diagnosis will be based on why the patient is in the hospital. We have certain parameters that we follow at ProHealth in determining why we're seeing a patient. So really visiting the patients and taking care of them and going up there and just getting a 24-hour diet recall and maybe further past that, just really diving deep into that and figuring out the best nutrition route that we can provide for them to further nourish their bodies. That might be from a certain type of diet, that might be from enteral nutrition or TPN. And TPN is nutrition through the vein if the gut isn't functioning, and enteral nutrition is nutrition through, either a NG tube through the nose or a PEG tube through the stomach. My favorite part of the job is talking to the patients, getting to meet the patients. As I said before, I'm passionate about serving others. So obviously talking to the patients and meeting them and getting to know them is my favorite part. The most difficult part of the job would be the unpredictability. I am a very regimen, routine type A person. So I've learned how to have a little bit more flexibility in my schedules and my routines, but that has been a difficult aspect for me to kind of switch gears there. Me personally, the hours and days that I work are Monday, Tuesday, Thursday, 7 a.m. to 2:45 p.m. And then Saturdays are rotated throughout the department, and Sundays as a dietitian at ProHealth are by consult and pager only. We do have other dietitians in our department that work full-time Monday through Friday. Their hours are, based on their schedule, typically 8 to 4:30. For me, I work on the medical surgical floor. I work with patients of all ages, patients mostly who recently have had surgery, and then patients who are inpatient for internal medical health issues such as diabetes or hypertension, or even wounds, sepsis, things along those lines. And then we also collaborate with the team for each patient that we are seeing. We don't necessarily see each patient in the hospital. As I said, we have certain protocol that we go by that determines what patients we're seeing on our assigned floors, but we do work closely with the doctors, physician assistants, nurse practitioners, nurses, CNAs, and medical assistants. This is one of my favorite parts of being a dietitian because I love to learn from others, and really learning from them helps us come up with the best plan for the patient. So we do have that team collaboration there. So this is the last slide, and as I said, I would cover skills that are beneficial to have as a registered dietitian, and then benefits of working for ProHealth Care. The first skill that I think is very important in terms of being a dietitian is communication. And as I'm going to reference the last slide, when you are working with other medical professionals, it is important to be able to effectively communicate and make sure that you are caring for your patient properly. So communication really, really goes a long way, and doing that effectively takes it a step further. And then organization, it's really important to know how to prioritize what patients you're seeing first. And moving on from there, patience is a really big thing in any career path. Things that might not move as quickly as you want, things might move more quick than you had expected. So just developing patience and being patient with the medical team and your patient is really, really important. And then perseverance, you just need to persevere, trust in yourself, be resilient, stand firm in your knowledge and what you know, especially when you are helping your patients and advocating for them when you are collaborating with that other medical staff. And then the benefits of working for ProHealth, we are always involved in the United Way Fund. And this is a fund that connects people in need to those who can help. And then being involved in presentations like the one that I'm doing right now is a benefit. You get to reach the community, you get to talk to the community and just bridge that gap on knowledge there. So on, of various different health topics. And then my most favorite thing, I put it as the last, but I'd like to elaborate on, is the people that I work with. The team of dietitians at ProHealth Care, every single member of the team is amazing. So really coming to work is one of the things that I enjoy doing. So yeah, that is all that I have for you in terms of being a registered dietitian on the inpatient side. So if you have any questions, you can always send something in the chat box and I would love to answer them.